Good morning. My name is Trina Miller, and I am with the Department for Public Health, and I am providing the FY20 Local Health Department contract training for the Public Health Prenatal Program. The Public Health Prenatal Program has been revised to align with the implementation of the Kentucky Public Health Transformation Model. This includes the transition from direct patient services to population health. An important aspect to note is that local health departments do not have to do or assure prenatal care. But the local health departments do have 4 key roles and responsibilities. These include, number 1, local health departments should assist with pregnancy presumptive eligibility, or PE, enrollment in Medicaid. Number 2, local health departments should be aware of prenatal providers within their community and be able to provide pregnant women with a list of providers and contact information. Number 3, local health departments should refer pregnant women to wraparound services such as HANDS, WIC, and referrals for smoking cessation, substance use, depression, and domestic violence. And number 4, local health departments will need to continue to complete the public health prenatal program reporting. In regards to funding, maternal child health will not provide funding for direct patient prenatal services. Local health departments will need to identify a funding source other than MCH funds. Local health departments may choose to use core public health block grant funds or other funding sources to provide direct patient services through an in-house prenatal clinic or to pay a contracted prenatal provider whom they refer women to if they choose to do so. In regards to optional local health department services and contracts, local health departments will not be required to contract with a prenatal provider. Under the Kentucky Public Health Transformation Model, if a local health department identifies prenatal services as a local public health priority, they may choose to provide services through an in-house prenatal clinic or contract with a prenatal provider to refer women to. The following are some DPH recommendations if you do establish a contract. Local health departments are encouraged to refer to ACOG guidelines and the current edition of Guidelines for Perinatal Care for the provision of prenatal services. The ACOG antepartum and discharge postpartum form provide standardized documentation. This resource details the number and types of visits, labs, and procedures that are recommended. The ACOG website is www.acog.org. Additional recommendations include, for standard clinical requirements, that facility supplies and equipment align with ambulatory obstetrical care guide standards as specified in the current edition of Guidelines for Perinatal Care. Clinical equipment used at an in-house prenatal clinic should be in proper working order, maintained and calibrated according to manufacturer's directions, and is sufficient to provide basic screening tests. In regards to staff requirements, prenatal care must be provided by an appropriately licensed or certified personnel acting within their legal scope of practice. ACOG recommends high-risk patients be seen by an obstetrician. Advanced practice registered nurses caring for pregnant women operate within their scope of practice. Registered nurses are not acceptable providers of medical care for prenatal clients, but may provide adjunct or support care in accordance with the scope and standards of the Kentucky Nurse Practice Act. Advanced practice registered nurses caring for pregnant women should operate within their scope of practice, certified as women's health practitioners and having both training and experience in obstetrics. If a contracted provider utilizes staff from his or her own office for assistance while at the local health department working in an in-house prenatal clinic, the staff member should maintain a current professional license and be educated and trained to perform the designated functions in the local health department. The functions which the individual performs should be clearly enumerated within the private physician's contract. In regards to billing and coding, the local health department is not required to pay for prenatal services. If the local health department provides prenatal services or refers a woman to a prenatal provider, the local health department should inform the pregnant woman in the language and manner, such as verbal or written, that the woman understands. Inform her of what services she will be expected to pay for, if and what services the local health department will pay for, or if she should work with a prenatal provider for all billing matters. The local health department should contact the local health operations branch for coding questions. If you have any questions, feel free to contact me at 502-564-2154, extension 4406, or you may contact me by email at trinam.miller@ky.gov. Thank you.